Now, what are some of the causes for this infection? Yes, we talked about, especially for the outside on the skin. We know maybe plaquing or people may be causing injury to the skin membrane. But for the other, other types of these infections, what are some of the common causes?
Acute sinusitis is predisposed by the same factors which I have told. Like if somebody is having allergy, it causes mucosal edema, and that leads to stasis of secretions inside the sinuses, causing invasion of that fluid by bacteria, causing acute sinusitis. Exposure to dust, smoke, air pollutants or industrial chemicals, that is second another common factor. And then come the anatomical factor, like a deviated nasal septum, anatomical blocks to the entry of the sinuses, like bigger concha bullosa or big anterhythmoid cells. These are like usually we detect it on the CT scan. Clinically, it is difficult to differentiate what factor is causing this.
Okay, and we also talked about some of the symptoms, especially for the skin that is affected. But now for the other types of infections and especially for the sinuses, what are some of the symptoms for those? And that is the bacterial infections for the skin.
Actually, I have already told, like the patient will be having, it depends
the
on the frontal
discharge.
headache.
Yes.
Second thing, second thing is that also the symptoms will be varied depending on the site of infection. Like if somebody is having just isolated sinus infection of a frontal sinus, the symptoms will be more located in the frontal sinus, like a frontal headache, pain when bending forward, pain around the eyes. Okay, if he is having issue with the maxillary sinuses, pain will be in the in and around the face and the nose, and he will be having pain in the eyes also, pain in the teeth also. Sorry.
Okay, all right, and especially for the children, where you talked about people clearing maybe their throat for some time. So in terms of either the children, do they also get some of these infections, the bacterial infection, the children, and is it more severe in children as compared to the adults?
Okay. Sinusitis incidence is less in children as compared to adults, but if it occurs, usually it's quite fulminant. Adenoid, persistently enlarged adenoid which are infected is a persistent source of infection in children, many of the children, and it can lead to secondary sinusitis. Adenoids is not a common factor that is seen in adults.
Okay, and then for those people who most of the time clear their throat, you'd find that they don't really know that they have sinuses. So in terms of symptoms, aside from, let's say, the pain and headache, depending on where the infection is, how else do they know that this is sinus and not maybe a common cold or not a headache? Because most of the time, especially when you have a headache on this frontal part, they will tell you that probably there's a problem with your eyes. So most people would go and get their eyes checked as compared to getting, the nasal check. Exactly. So how do you know that this is more of nasal infection and not maybe pain in the eyes or a problem with the eyes or any other parts of the body?
When a person presents with persistent clearing of the throat or a postnasal discharge, usually one should check the history. Because the direction of flow of the mucus from the nose is towards the nasopharynx, it tends to get collected early in the morning. So that is one factor. Secondly, for when the person gives this history of persistent clearing of the throat, we can do clinical examination. Then if it is not satisfactory, one should always go for a nasal endoscopy. With nasal endoscopy, you can see the opening of the sinuses, and if the person is having a diagnosis of sinusitis, then you will definitely see mucus coming from the opening of the sinuses inside the nose. Okay. To confirm the diagnosis further, then one will require a further radiological investigation. CT scan is the gold standard investigation.